I'm Drame. I'm a non-invasive cardiologist with Drame Health. So I am the youngest of 3 siblings. My family is originally from Côte d'Ivoire, which is a small francophone country on the west coast of Africa. And I've been here since I was about 16, 17. And just about a couple of months ago, I got a beautiful little daughter named Miriam. I love everything artsy. So plays, theater, painting, musical, you name it. I love everything that revolves around arts. But over the past few months, I really haven't had the chance to do anything much just because of my daughter. But that's pretty much what I do when I get the time off. I do come from a medical family. My mother is a pediatrician back home, so that's where my love for medicine came from. So at a young age, I saw her practicing medicine, so most of my summers were spent at the hospital with her. So very early on, I knew that medicine was what I wanted to do. I saw firsthand what it was to take care of patients and what a privilege it was to take care of a patient. So I knew back then that I wanted to do medicine. So I went to London for Masters in Public Health, and over there again I met some physicians. They understood diseases at a level that I did not, having done only biology. So I decided that I wanted to do more with patients, so I went into medical. So I did a rotation when I was still in medical school with a great cardiologist. I loved everything about it. I loved looking at echoes. I loved his interactions with patients. I was fascinated by the heart and how everything worked together. I just fell in love with cardiology, and I knew, even going into internal medicine, that cardiology was what I wanted to do. So I left Côte d'Ivoire in 2006. I came here when I was 17. I went to Maryland. I did a bachelor in biology there with a minor in psychology. When I graduated, I took some time off. I worked in medical research for a year or so. Then I went into public health. So I did a master's in public health in London. So I left the US for a couple of years. And then when I finished that, I worked a bit in the public health field. I realized that I really wanted to do medicine, proper medicine, even though I love the aspect of public health as well. But I went into medical school, St. George's. And then from St. George's, I came to the US here, did internal medicine residency at the University of South Florida. After that, I went into cardiology fellowship at the University of Kentucky. So that's where I did my cardiology fellowship before coming down here in Dalton. I would say my favorite part of being a physician is my interactions with patients. I know it sounds cliche, but it is true. I think when you get to meet a patient and they open up to you about what is going on with their lives and the diseases that they have, and you get a resolution or you get to treat them and they come back to your office smiling, I think that's the biggest reward one can have. And that's the best part about medicine, I think. I want my patients to know that I will always take the time to listen to them, that I will always try to treat them as if I was treating a family member. Seeing a patient at his weakest time, you can have a patient in the hospital very sick, and then you get to analyze all of the data that you have and then find a proper treatment, and then the following week or month, or sometimes it takes more than a month, it takes a year, but you get to see them back in clinic, walking and feeling better. I think that is the most rewarding thing in the field that I chose, for sure.